Hello, everybody, and welcome to the MMOA podcast brought to you by the Institute of Clinical Excellence. My name is Annoushka Ranaraja, and I'm a doctor of physical therapy and member of the modern management of the older adult division of the Institute of Clinical Excellence. In light of April being Parkinson's Disease Awareness Month, we're going to discuss the 2026 updated Parkinson's Foundation and ACSM guidelines. We've heard the term exercise is medicine for years, but this is huge for Parkinson's disease as research shows that regular exercise does more than just manage symptoms, but it can alter the course of neurodegenerative process itself. So PT hasn't had the best evidence, but we really want to move into making our PT sessions or therapy sessions look more like exercise because that's where we're seeing the biggest benefit for this population. The big shift this year is moving away from just staying active to intentional multi-domain training. So we aren't just looking at keeping people moving. We're using exercise to increase blood flow to the brain and really drive neuroplasticity. The 2026 ACSM guidelines emphasize 4 specific domains. So aerobic training, strength training, stretching, and BAM or balance, agility, and multitasking. For aerobic training, we're looking at the engine. So we're aiming for 150 minutes a week of moderate to vigorous activity. The 2026 update is even stricter here, saying at least 3 days a week of 30 minutes or more. We want rhythmic, continuous movement for like brisk walking or cycling or swimming, and really choosing the exercise that's most appropriate for the patient or client in front of you. So if you have a patient that is unsafe to be walking quickly on the treadmill and you don't have a body weight support, that's okay. We will shift to doing something like the bike or the new step and just driving intensity there, because we all know that you can push on the new step if you really want to. It's just a matter of doing so. High intensity is working between 80 to 85% of that max heart rate, and we know that it's safe and more effective at slowing symptom progression than moderate intensity exercise. But working, especially starting off, working at that moderate intensity to start will still give benefits, and that's looking at that 60 to 65% range of max heart rate. For strength training, we're looking at building the support. So for this, it's at least 2 to 3 days of non-consecutive training major muscle groups. The 2026 update specifically highlights using resistance bands or weights to fatigue, focusing on 8 to 12 reps per set, with emphasis on the extensor muscles so that we can decrease that flexed or stoop posture. And then this kind of goes hand in hand with stretching. So this is working on the range of motion. And this is at least 2 to 3 days a week. And we're going to focus on flexed posture, which is common in Parkinson's disease. So we want to stretch out this chest and the hip flexors for this. When I'm discussing this, I also want to keep in mind the 2022 clinical practice guidelines, which state low evidence for stretching, but that's looking at that in therapy itself versus teaching these patients how to do them at home so that they have the tools to do it at home and continue stretching, but not taking up so much time within our sessions to do so. And then BAM, so that balance, agility, and multitask training, that's looking at that brain-body link. And we want to do 2 to 3 days of Tai Chi or yoga or dancing or boxing, or if it's within the session, maybe you're looking at obstacle courses. I love doing obstacle courses with cognitive tasks that are more specific to where I'm seeing my patient falter at home. So adding in where they're stepping over objects, stepping within a narrow space, or turning in space while multitasking. Making it specific to your patient is so helpful and important to them and how they're going to see that carry over in their day-to-day life. Multitasking seems to be the biggest buzzword in 2026. And why? Because Parkinson's isn't just a muscle problem, it's sequencing problem in the brain. So if your patient or client can walk while counting backwards or performing multi-directional stepping, dodging obstacles, looking at agility, you're training the brain to handle the complexities of real-world movement. If your patient has freezing of gait, the 2022 CPG's update emphasize external cueing, for instance, using visual cues like lines or cars on the floor while walking, or auditory cues such as a metronome or a song with a good beat. And in 2026, we want to integrate this with balanced agility and multitasking as well. Another thing that we want to carry over from the 2022 CPGs is task-specific training. So if your patient or client struggles with getting out of the car or turning in a small space, therapy should involve that movement. We don't just want to get them stronger. We want to practice specific tasks to build a neural pathway for them to be able to perform these things more safely at home. Some key takeaways include that the Parkinson's Foundation emphasizes that regular, consistent exercise is key to long-term management, and starting an exercise routine as soon as possible after diagnosis is crucial for maximizing benefits. We also want to advise our patients or clients to exercise during on periods, especially when they're home by themselves, because that's when their medication is more effective, so it will improve their safety with these things and decrease their risk of falls. But I will say that as a therapist, I occasionally like to work on off period or during off periods as well to see how to best advise and prepare patients for those periods and see if we can work through movements with different cues. Before we wrap up, I want to talk about the psychological side because this is so important with this group. Both the 2022 CPGs and the 2026 documents mention behavior change. And this is a very important part and kind of somewhere where we may falter as therapists because we're so used to having them in clinic with us. But a therapy plan is useless if it's not followed. So the 2026 update encourages community-based exercise. Whether it's rock steady boxing or a PD-specific group dance class, social accountability is what makes these guidelines sustainable. We're seeing that people who exercise in groups have better non-motor outcomes, meaning better moods and less anxiety, which then allows them to want to exercise more continuously and have that as a long-term plan for themselves as well. And knowing your community-based programs is really helpful to bridge that gap once you're discharging them from therapy services. So to recap for our listeners, number one, you want to hit that 150. So aim for 150 minutes of aerobic work weekly, looking at moderate to vigorous intensity, especially if we can work up into that high intensity. You want to, 2 is adding that BAM, so the balance of agility and multitasking. So don't just walk, but challenge their brain with multitasking. 3 is following the CPGs, so using things like external cueing and task-specific goals. And then number 4 is timing. So especially when they're on their own, make sure that your patients are working through the training hard when their medicine's working best for them. And then every once in a while, you might want to throw in a session just so you can see what their off period looks like. But that's all I have for you today. If you're interested in learning more ideas on how to manage complex patients, join us for a live course or online course, which you can find on ptonice.com. Also, click the link below if you want to stay up to date on all things geriatrics in less than 3 minutes every other week. You're going to join our free MMOA digest email. But thank you for joining me today, and I hope you have a great night.